of being obese. Obesity has a lot of complications. And one of the major complications is, we call it cardiovascular problems, which has to do with hypertension. The bigger you are, the more likely you are going to become hypertensive. And once you are hypertensive, the more likely that your drugs may not work for you because of your weight. So hypertension and stroke are one of the problems of obesity. And actually, they say about 1.5 million Nigerians are diagnosed as being obese every year. 1.5 million. So, hypertension and stroke. And when anybody has a stroke, you can never become the way you were before because there's a brain damage. The second one that has to do with the complications of being obese. When you are obese, when you are big, you have a tendency of having arthritis, especially women. That is why people who are doing Botox, trying to get big hips, are just preparing themselves for big problems later on. Because your legs, your feet are like pillars of a house. And if the weight of the house is too much for the pillar will have problems. So when you are big, you are putting pressure on the pillars. What are the pillars? They are your feet. So, and one of the problems is that you have a tendency of developing arthritis. And the problem is that arthritis has no cure. Once you have arthritis, you have it for life, and this could be highly debilitating. I used to tell somebody, there was a woman described in the Bible that he was bent down by a disease. Sometimes we jokingly say that probably the woman has arthritis. Arthritis makes people to bend down. When I was coming, I saw a man. He was bent. And when you see people with arthritis, they usually don't live good lives. You cannot, if your house is beautiful, you have air conditioner, you can't use it. Again, one of the complications of being obese. Obese people are prone to they have a higher risk of developing cancers of the various parts of the body, especially cancers of the breast, cancer of the womb. The more fat you have in your body, the more you are predisposed to developing cancer, because there's a relationship between, actually people don't know even what causes cancer. But the thing is that the more fat you have in your body, the higher your chance of developing a cancer. So we advise you are trying to avoid being overweight so that you don't have the problems we have just enumerated. And one thing about being obese, once you gain weight, it's difficult to lose it. Once there's a weight gain, it's not easy to lose it. And how does it come? One thing is that when we eat, your body takes, if you eat amala now, the amala can amala enter your blood? No. The amala is what? It's a complex carbohydrate. Your system, your intestine is going to digest and break it down to simple sugars. And these are the simple sugars that enter through what we call the villuses in our intestines, that enters into our body to give us energy. But when you overeat more than you exercise, what happens is that your body will just use the little energy you need, the sugar you need to give you energy. The purpose of eating is to produce energy. So your system will take the little sugar you need for energy. So what now happens is that the excess that you don't need now it's now converted into fat and get deposited in the various parts of your body. This is how people accumulate fat. You eat more than you need. You eat more than how active you are. Your body takes the little you need for your daily activities. The rest will be converted to fat. This fat is going to be stored in the various parts of your body. That's why you see people coming in as late as 11, 12, eating. And you know when you eat late in the night, you are not going anywhere anymore. You are going to sleep. So all that your body needs is for energy for your brain to work and little energy for your kidneys to do their normal works. The remaining part will be converted into fat. and stored in your body. This is how people accumulate fat. So how do you prevent being obese? You prevent being obese by watching your diet, what you eat. You see, people love yogurts, all these sugar-containing stuffs, yogurt, ice cream, all stuffs. Majority of them are simple sugars. They are loaded with sugar. So these sugar, once you take them, they are going to be converted into fat. 1, eat less. 2, eat at a good time, not eating late. 3, the quantity of food you eat. This helps you to prevent it. Once you have it, it's difficult to take it off. Then the second level is taking drugs. Exercise and then eating well. Then after that, is when people are obese, how do you manage them? When they take drugs and when they go on exercise, some people, they go on exercise, they go on diet, and they still not lost weight. So it's then you now move on to drugs. There are 2 types of drugs that are used for obesity. One of them, what it does is that once you eat and you take these drugs, the drug will prevent the food you have eaten from being absorbed. So it's going to come out more or less undigested. So the feeling you just have is that the feeling that you have eaten. You love to eat this fish, you love to eat this rice, you love everything. It gets into your system, but the drug will prevent it from being digested. So you just pass it out. But the problem with it is that one of the problems it has is that it causes a lot of diarrhea. Because you are going to have so much undigested food, you are going to have diarrhea. Then there's a second type of drug you use. That one, everything we do is controlled by the brain. You want to sleep, is controlled by your brain. You want to talk, is controlled by your brain. So there's a center in the brain that controls our appetite. We call it the satiety center. It is when you are eating, this center tells you you are full. If your center is damaged, you keep eating and eating and eating. But once you are full, it is the center that will tell you that you are full, stop eating. So what this drug does is to constantly give you the impression that you are full so that you don't eat. And if you have taken these drugs and still they are not working, the next thing you can do is to do a surgery. And that surgery is a bypass. They bypass your stomach so that your stomach will be rendered useless, so that the little food you eat, you know the intestine is not as big as the stomach. So the food you eat, after eating a little bit, you easily get full. It also has its own complications. So the most important thing is prevention. Thank you. Then I'm asked to talk about infectious diseases because time is gone. What are infectious diseases? I think I will try as much as possible to be practical than being theoretical on this one. Infectious diseases are diseases that are caused by microorganisms that invades our tissues, invades our body. What are the microorganisms? Some of them are bacteria, some of them are virus, some of them are fungus, some of them are parasitic. I'll just run through them briefly. The parasitic one are the kind of worms you have. Worms, some people believe that it is normal to have worms, that they are part of the tenants of the body. No, God did not create us with worms. Sometimes when people tell me they are making so much noise, say, doctor, I have so much worms in my tummy. I will tell them my tummy makes noise too. If you look at the intestine is like a snake. If you have ever opened the intestine, opened up a human body, you see the intestines moving. That's how they digest. That is those movements, the movement of the muscles that helps food to move from one portion to the other. But somebody goes, and some of these parasites are really bad, especially for children. I have a video where a surgery was done. In fact, they have to open, because after taking drugs, they could still not expel the worms. They had to cut the intestine, and they were bringing out the worms with forceps. It was so much of worms. How do people get worms? One, you go to buy apple. Mama, give me apple. She sells apple and give it to you. Or you even see some people, they are selling rice and plantain. Do you know what they do? They take the fork, pick the plantain, and use the neighbors, to push the plantain inside the plate. Have you seen it before? You don't know. This woman had just gone to the toilet. And most of them see where they sell food. Do they have toilets? Even the ones that have toilets, even fast foods. You see how the toilet looks, even in some fast foods. Goes into the toilet. She comes out. Mama Silifa comes and wants to sell apple or wants to sell rice and plantain to you. And she just came out of the toilet. And in most cases, you see their nails, long fingernails, harboring germs. She goes, give you apple. You just pick your apple and you don't wash. The next thing you just do, you begin to eat. When I get home, I bring apples and stuff. And I'm washing. My kids are like, Daddy, what are you doing? I said, I'm washing away germs. Sometimes you soak them in vinegar. Or sometimes when we don't have vinegar, I pick sponge. I begin to wash. I said, I don't want to have worms. I can't have worms. You can't have worms. I can't. Because I know what causes it and I prevent it. So he gives you the apple, give you the rice, and you just go ahead, you don't wash, and you put it in your mouth. You see some of them, they are selling soft drinks. In my office, I'm not sure if Esther knows. When I say, get me a bottle of soft drink, I say, once they bring it, I go and wash it. Once you wash it, I won't put it in my mouth. I have to use my cup. When you say, give me a bottle of Pepsi, from the people selling Pepsi, do you know what? They are going to hold it right where you are going to put in your mouth. And you will just use your hand. Then she comes. They don't wash her hand. Even if she did wash her hand, she didn't use soap. She has long nails. Feces already inside. She used that hand to give that soft drink. Use that same hand to give you your apple. And you put it in your mouth. What have you done? You have just eaten somebody's feces. Yes, that's why I said I will be a bit practical. I will soon finish on this. Do you know how worms comes in? When somebody has a worm, the worm directly doesn't get into you. What it does is that the worms have hooks. They use to attach themselves to our intestines. That's how they suck blood. Inside, they multiply. And what do? They begin to shed their eggs. These eggs, they're in the intestine. And your feces comes from the intestine. They begin to shed their eggs. These eggs comes through the feces. It is the eggs that are now patched on the apple, on the mango, on all sorts, on the soft drink, because the woman has gone to the toilet, she wipes, you have fecal matters in her hand. Those fecal matters contains eggs of worms. Immediately these eggs get into your own system. They hatch and they become live worms. That is how people get worms. So when people say deworm, I don't need to deworm. I don't eat such stuffs. I will never deworm because I can't have it. Some people will say, typhoid is my problem. I know this in our laboratories. Take a blood sample from a newborn baby. Tell them, please run this sample for me. Most likely it will come out as, you have typhoid. You see, people say, typhoid is my problem. Not all the problems are typhoid, but in some cases, the same scenario, that how you get worms is the same way you get typhoid fever. Somebody has typhoid. He or she has the bacteria. So we know what they call gallbladder. Gallbladder. That bitter part, that greenish part that is around the liver. That is where there are some people they have typhoid. They are no longer infected. They are no longer having the problems, the symptoms, and the signs, but they become carriers. They begin to give it to people. We call them carriers. People who are carriers of typhoid, they have the typhoid bacteria in that part of your body, of their body, which is called the gallbladder. So what they do, gallbladders are involved in digestion, especially when you eat oily or fat materials. And this is how they work. Once you have eaten something that is fatty and you want to digest it, the gallbladder will squeeze itself to push out the chemical to help you to digest. That is why people who have gallbladder stones, they keep having intermittent pain, especially the same way this person has gone to toilet too. Wiped her boots. Same way this person has gone to toilet too. Wiped her boots. Comes to you, serve you the food. You eat it. That's how you also pick up typhoid. That's what I tell people, no matter how sick I am. Doctor, I was so sick and it was so bad I was afraid. Could it just be ordinary malaria? People are saying, doctor, why don't you run a wider test? I said, I can't have typhoid. He said, just run it. We ran it. It was absolutely nothing. Because I know what causes typhoid and I avoid it. And when people say, typhoid is my problem, I say, you should be ashamed of yourself. Typhoid is a disease of poverty. Typhoid is a disease of ignorance. Typhoid is a disease of an unkept environment. So, when you know most of these things, you save yourself injections. I can't imagine taking injections or all those typhoid stuff. I say, I don't want. So please, I don't want to have typhoid. I don't want to take injections. I fear injections. I don't like it. Yes. So when I say I want to be practical as possible, as much as possible, just to use the common things we suffer around us. So that's talking about the parasitic ones, the typhoid and the worms are the common ones. Then we talk of the viral ones. The viral ones like hepatitis and HIV. And unfortunately, HIV is on the increase again. I won't tell you a part of Lagos that we have our colleagues there. They are reporting an upsurge in incidences of HIV. It's so much now. A lady was in my office like on Friday. She said, doctor, I want to do HIV test. We ran the test. Positive. Young lady said, I said, okay, can I do a confirmatory test? I said, we'll do a confirmatory test. But you can't have the result today. The result came out as positive. You know, when you do an HIV screening, the first level is positive. We take it further to confirm, because not all positives are actually positive. And it was positive. She just, well, you know what she told me? She said it was just one night that she suspected maybe something was wrong. That's why she decided. She said she did it after 2 months, 3 months. It was not. She just said, okay, let me wait for 6 months and do it. She worked somewhere. She had a nice time with a guy. I said she noticed something, that she used a barrier, a condom, but they had issue with the condom. But she noticed some things and that she was not comfortable. And she came for HIV. That's why she's decided that, let me run an HIV test. Though HIV now is like any other disease. It doesn't kill. If you take your drugs, you can live to be 100 years. But the issue is that, will you want to be taking drugs for life? Once you have it, you must be taking your drugs for life. If you take your drugs for life, nothing will happen to you. There is so much of permissive. I don't know how I would describe it. It's like sex. Sorry. Sex is cheap now. You have it everywhere. I have so many people who come to me. You met somebody this month and you got pregnant that same month. You see, no, there's hunger in the land. There's poverty. People are struggling. You see, sometimes when people have it, you can't just run them off. They are just being unfortunate. Circumstances led them into it. Some of them, when you hear their stories, you pity them. But that should not be the reason why you have it. There's so much of it out there in town. HIV is on the increase. So if HIV is an infectious disease, because we said infectious diseases are microorganisms, diseases that are caused by microorganisms that invade our body, invade our tissues. And the same way you get HIV is the same way you also get hepatitis. Not just because of sex that is just so free anywhere. You see, you know now, my husband is cheating me too, I can cheat. So she goes out to cheat too, the man goes out to cheat. So you bring your own, I bring my own. HIV, we share. And you know what? This same person has other people, has other girlfriends. So it's like you have a girlfriend who has 5 other boyfriends. So that means you are in a relationship with 5 other people. I used to have somebody. She was a big man in the country. She was always on NTA network every week. I don't want to mention the program so that people don't begin to think. He was HIV positive. But you know what? She has a very beautiful, very good wife. But this guy was very comfortable. Any World Cup, he was always there. A week before World Cup. Any Olympics, he was always there. A week before Olympics. He will always come back with souvenirs for me. But he will come to my office with beautiful girls as girlfriends. He has money to give them dollars. Is it me that will tell the girl, oh, come, this guy has HIV. Can I? No, I keep quiet. You're on your own. But he had money, and the funny thing is that the wife told me, said, doctor, my husband is not using condom with all these girls. He has the money. Sir, if you know what is going on. I was somewhere. I have some guys, Lebanese guys. Say, doctor, can we say? I was in there. Well, do you know? 3 of them slept with the same girl the same time. One went and came out. I had some things to do in the house that day. One went, came out. The second one went, came out. The third one came. It was the third one. It was at the point of the third one, me, I left. Because I finished what I came to do for them. And you know what? The guy now asked me, you know, when they speak that English, if you're not very attentive, you may not actually understand what I'm saying. The guy now said, Doc, please, can you tell them, am I staying overnight? I was also a very bad guy before, very bad. Very bad, from University of Lagos, Eltru. Very bad. Sometimes when we bed early, now come down and sit down. So no, sometimes when I see some people doing some stuff, I say, show Shenke Kereni. See. You see, and the guy was calling. So she said, let me ask them, am I staying overnight? I said, okay. Bob, is she staying overnight? Bad guys. And they said, no, doctor, he's not staying. She's not staying. I said, okay, they said, you are not staying. Do you know what? Immediately she began to book another appointment for Atikeja. And this girl may have a boyfriend maybe somewhere in Newi or somewhere in this thing who believes her girl is a good girl in Lagos. You see, some women don't know they are even HIV positive until at the point of antenatal clinic. You know, when you come for antenatal, it's a compulsory test. You have to run it. When you run it, you see it. I had a woman, unfortunately, this woman went to commit suicide. We told her, madam, you see, I have to tell you, because if I do not tell you, you deliver, maybe later, you have it, somehow, you got it somewhere, you were told somewhere, you were positive. They will say it was where I delivered. They will deny it. So you have to run it and let them know. And unfortunately, you won't tell the husband because it's a confidential stuff. So I said, madam, a very beautiful woman. The test, you were HIV positive. She cried and cried and cried. And that was the last time I saw her in antenatal clinic. She went somewhere, delivered. After delivery, she sent somebody, go home and go and pick something for me. Before that one came, she committed suicide. She died. Because she felt that, she was a big woman, popular. She just felt, how will I have HIV? It's better I die. And the husband was a man all over the town. The husband also was a rich guy, had all senators, all kinds of politicians as friends. So the man refused. We didn't know how she got it, but she never came. Not to say that all HIV patients got it through sex. There's drug abuse now. Women are even abusing drugs. So once you abuse drugs, it will get to a point you also begin to use the injectables. There are some drugs you inject. So you start from sniffing, you get to a point you now begin to take the real injections. So you get it through them. Some women, now people are buying wigs, so which is better. But before, people will always go to these hairdressers, please do my hair for me. They will not go with their sharp objects, their sharp instruments. So the one they use for you, they are using for this person. They will tell you they've sterilized it. How are you sure it was a proper sterilization? Then for the men, you say, I want to go and shave. They shave for this one. If you even see, there are sometimes you have some wounds you don't even know until water touches it or sweat. So you have gone to shave. They shave you, they shave you, they shave you. You get home. And you know, after shaving, they put something that looks like spirit. It becomes pepperish. How? Spirit can never be painful without a cut on the skin. So once you put spirit on any part of your skin and it's pepperish, that means there's a cut. That is why when you go to the hospital and they want to take your blood, they use materials that contains spirit, isn't it? They clean your body. Do you have any pain? No. But the moment you have a cut, even it could be a micro cut that you don't even know. So they shave you, you have micro cuts you don't know. And then they've used it for somebody who is HIV positive, you also pick it. So, I don't know how to prevent that, but it just depends on lifestyle. So, viruses. Then, the last one that I'm going to say, let me just use this as an opportunity to bring to our notice some things that happen. I've told you these few ones. This is going to be the last one I will say. You see, somebody said, maybe some of you must have seen it on WhatsApp, that don't take groundnuts or this your sobos, or zobos, or what they call it. Be careful the kind of containers you use. But how careful can you be? You are not the one producing the zobo, and you are not the one producing the groundnut. They are already packaged inside those bottles. You just go there and pack. And they were saying that some people go to hospitals to gather plastic bottles to resell. And I realized that this is true. Because I went to the back of the hospital. Esther knows the back. And I saw so many bottles, plastic bottles. Do you know what they were? It was our cleaner that was preparing them to sell. And that is what happens in different hospitals. And I was telling my friend yesterday, he is in Lutz, that I read so. He said, in his presence, somebody who had tuberculosis spat inside the bottle. And right there, the cleaner picked it up, packaged it with others. And you know what? Do you think they're going to watch them like Coca-Cola does their own in the factory? No. You just use water, shuku, pour it away, and give you. And you'll be having tuberculosis and you'll be wondering where did they come from. You think it's the village people. No. It's not the villagers. No, some people use those bottles to pee. Even in the hospital. They pee in the bottles. Spit in the bottles. So, I think you should be careful where you buy your granules, how you buy your zobo. I saw another one where people were, it was a large, people are terrible. It was a large scale production of this same granule. You see, they wanted to save money. Instead of using, what they call it, the normal fire. You use fire now to fry granite. They were using acid. There was a way they use acid. It fries it just exactly like you fry it with fire. And you'll be wondering, how are people... You see, we are beginning to see women of 26 years having breast cancers. Yeah. Breast cancers, 26. You are beginning to see all kinds of ovarian cancers. And you begin to wonder how this one's coming from. There are so many bad things in the market. You see your palm oil, somebody is adding azodine. You know what azodine? Azodine is a carcinogenic substance. Azodine is a dye. They add it to the palm oil to make it so red. That is why you taste some palm oil, you see that the taste is funny. And people begin to develop cancer. You see, how has this come? You can never be too careful. You can never be too careful. You may choose. What is the source of your palm oil? If you know people you trust, that not just buy from the open market. I'm not spoiling those of you who are selling palm oil in the market. But we have so many diseases that are coming up that you don't even know. So the only thing is that you cannot be careful enough. when people add azodine to what we eat. And you know what? Again, you have people, especially caterers, these big time caterers, they want to prepare food, they add paracetamol. What does paracetamol do? Paracetamol it's a catalyst. It acts as what is a catalyst? A catalyst is anything that, rate of reaction shortens it. They add paracetamol. And you see that the meat, because they want to cut corners, they want to cut their expenses. They don't want to spend so much on gas. Gas is expensive now. They add paracetamol. It's something that is happening. It is happening. It is happening. They add paracetamol to it. They boil their beans and boil their meat. It becomes so soft. And do you know what paracetamol does? Immediately, paracetamol goes under heat. It becomes a cancer agent. It becomes a cancer agent. So, I always tell people, be careful how you eat. Most of the problems we have are problems of what goes on through us. You see, when you look at Asia, Japanese people, they don't have all those terrible sicknesses Americans and Europeans have because they eat more of fresh vegetable stuffs. That is what you eat. Natural food. If I tell you something that happens on some fast food, let me tell you, when NAFDAC, does anybody operate a fast food here? Yeah, or you work there. If you work there, you will know what I'm saying. You see, when NAFDAC says we are coming, you know, everywhere is corrupt now. When NAFDAC says we are coming to visit your facility, what do? All those that are bad ingredients, Ajinomoto, Vedan, they go and hide them. So they will come, it is the same, somebody in NAFDAC who will call them, we are coming, remove them. So when they come, they check, they don't see it. So once they leave, they bring them out and begin to cook for people. And you wonder where is sickness coming from. Pastor will pray and do deliverance, cast out demons. Doctor will say, we can only try. And you see, you need to see patients who have cancers. You will appreciate what cancer is. Sometimes they wish for death. So people do all kind of. There was a time I went to eat at this fast food. What do they call it? At Abule Egba. Let me not mention that fast food. Just at that, where that light is. That fast food is by the right. Let me not mention the name. And the test was, my younger brother just said, come. Because my younger brother used to be a manager in one of the UAC foods. Said you added Vedan. The lady was shocked. She kept quiet. She didn't say anything. My brother just said, Egbon, let's go. Because he had worked with them, he knows them. I have people who want big time stuffs who are managers there. They will tell you stuffs. Some people will put nail inside what they are cooking to get it fast. So, all I can just say is that let's be careful how we eat. Thank you very much.
Thank you very much. If you are clapping, please clap better. Thank you very much, sir. Thank you very much, sir. Quickly, we are going to questions and answer. If you really gain a lot, you can sit down. You can sit down. If you really gain a lot, please clap your hands very well. In essence, what Dr. Oloye has been saying since morning is your lifestyle. Modify your lifestyle. The way you eat, the way you live. Don't eat anyhow, don't live anyhow. Lifestyle management is very, very important, even more than drugs that you are going to take in your mouth. I pray God will help us in Jesus' name. If you have questions, if you don't know how to say it, if you can write it down, pass it to the ushers. But if you have questions, quickly they have like 10 minutes for questions. So, questions for Dr. Oloye and questions for Dr. Emmanuel. If you are having issues about a career path you want to go into, or a business path you want to go to, or have some questions about some careers and health, or even on health issues, or about the topic that's been discussed, or some other topics that you just want to quickly ask that is not clear, that you want to ask some questions, this is the best time for you to ask. So if you have questions by this side, can just raise up your hands. I'll give you the mic to ask for them so that we can start from there quickly. Okay.
Sorry, I want to ask Dr. Oloye, how does nail affect the food we make? Because my mom, she used to put nail in beans, moi, stuff like that. So I want to ask, how does it affect it?
All right, sir.
Thank you, sir. A nail is a metallurgical material. It's a metallurgical material. So how do you feel boiling iron with your food, or licking? Just pick an iron and begin to lick it. You see, no matter how tough or hard an object is, if you subject it to heat, part of it will melt. You may not see it. Thank you, sir.
Thank you very much. Do you understand? Any other question, please? Any question? Okay, you're writing. Pass it out. If you're writing, please quickly pass the question. Do you want to ask a question? Okay, a question is there? Okay.
All right, thanks for the lecture. Okay, my question is this, though I ought not to ask him, but people say, this is a medical person, why is she asking? But I just need to ask him because we learn every day. I'm still learning, praise God. And the question is, why is it that when you treat a particular infectious disease, it keeps reoccurring, even when the person haven't been exposed to that same maybe microorganism that triggered it, it just keeps reoccurring. And you kind of wonder, the drugs you take is still not effective. Even when they change the drugs, it's still not effective. What causes the reoccurrence of that same infectious disease? Thank you, sir.
Thank you.
Okay, thank you very much. I may want to know the kind of infections you're talking about. I have an idea, but I should be sure what you're saying.
All right. Actually, had a patient that had one infectious disease like bacterial infection, that is Staphylococcus aureus, and I treated him. It was like he's still having it. I was like, how about it?